Section 4. Somatosensory system and pain. The somatosensory system processes information about touch, position, pain, and temperature. The receptors involved in transducing these sensations are, as we have discussed, mechanoreceptors, thermoreceptors, and nociceptors. There are two pathways for transmission of somatosensory information to the CNS: the dorsal column system and the anterolateral system. The dorsal column system processes the sensations of fine touch, pressure, two-point discrimination, vibration, and proprioception, which is knowing limb position. The anterolateral system processes the sensations of pain, temperature, and some light touch. Somatosensory receptors are categorized according to the specific sensation that they encode. The major groups of receptors are mechanoreceptors for touch and proprioception, thermoreceptors for temperature, and nociceptors for pain or noxious stimuli. Let's start with mechanoreceptors. These are subdivided into different types of receptors depending on which kind of pressure or proprioceptive quality they encode. Some types of mechanoreceptors are found in non-hairy skin and other types in hairy skin. Mechanoreceptors are described in Table 3-3 according to their location in the skin or muscle, the type of adaptation they exhibit, and the sensation that they encode, and they are illustrated in Figure 3-8. Here you can see the listing of various mechanoreceptors: Pacinian corpuscle, Meissner corpuscle, hair follicles, Ruffini's corpuscle, Merkel's receptors, and tactile discs. These are located in various locations within the skin and, in fact, within the subcutaneous and intramuscular areas. They range from very rapidly adapting, as in the Pacinian corpuscle, to the slowly adapting, as in the tactile discs. And the type of sensation encoded by each is listed for each mechanoreceptor type. Here is an illustration demonstrating the types of mechanoreceptors in relation to other components within the epidermis, dermis, and subcutaneous tissue. As you can see, the very rapidly adapting Pacinian corpuscle is deep in the subcutaneous tissue, whereas the Merkel's receptors are wrapped around the hair follicles and are in fact the most exposed receptors. An important characteristic of each receptor is the type of adaptation that it exhibits. Among the various mechanoreceptors, adaptation varies from very rapidly adapting, as in the Pacinian corpuscle, to rapidly adapting, as in the Meissner corpuscle and hair follicles, to the slowly adapting, which includes Ruffini's corpuscle, Merkel's receptors, and tactile discs. Very rapidly and rapidly adapting receptors detect changes in the stimulus and therefore detect changes in velocity. Slowly adapting receptors respond to intensity and duration of the stimulus. Let's talk about the Pacinian corpuscle. These corpuscles are encapsulated receptors found in the subcutaneous layer of non-hairy and hairy skin as well as in muscle. They are the most rapidly adapting of all mechanoreceptors. Because of their very rapid on-off response, they can detect changes in stimulus velocity and encode the sensation of vibration. Meissner's corpuscles are also encapsulated receptors found in the dermis of non-hairy skin, most prominently on the fingertips, lips, and other locations where tactile discrimination is especially good. They have small receptive fields and can be used for two-point discrimination. Meissner's corpuscles are rapidly adapting receptors that encode point discrimination, precise location, tapping, and even the sensation of flutter. Hair follicle receptors are arrays of nerve fibers surrounding hair follicles and hairy skin. When the hair itself is displaced, it excites the hair follicle receptors. These receptors are also rapidly adapting and detect velocity and direction of movement across the skin. Ruffini's corpuscles are located in the dermis of both non-hairy and hairy skin, as well as in joint capsules. These receptors have large receptive fields and are stimulated when the skin is stretched. The stimulus may be located some distance from the receptors it activates. Ruffini's corpuscles are slowly adapting receptors. When the skin is stretched, the receptors fire rapidly, then slowly adapt to a new level of firing that corresponds to stimulus intensity. Ruffini's corpuscles detect stretch and joint rotation. Merkel's receptors are slowly adapting receptors found in non-hairy skin and have very small receptive fields. These receptors detect vertical indentations of the skin, and their response is proportional to stimulus intensity. Tactile discs are similar to Merkel's receptors, but are found in hairy rather than non-hairy skin. Let's look at thermoreceptors. Thermoreceptors are slowly adapting receptors that detect changes in skin temperature. The two classes of thermoreceptors are cold receptors and warm receptors, as shown in Figure 3-9. The receptor functions over a broad range of temperatures, with some overlap in the moderate temperature range at approximately 36 degrees Celsius, where both receptors are active. When the skin is warmed above 36 degrees Celsius, the cold receptors become quiescent, and when the skin is cooled below 36 degrees Celsius, the warm receptors become quiescent. If skin temperature rises to damaging levels above 45 degrees Celsius, warm receptors become inactive. Thus, warm receptors do not signal pain from extreme heat. At temperatures above 45 degrees Celsius, polymodal nociceptors will be activated. Likewise, extremely cold or freezing temperatures also activate similar polymodal nociceptors. These nociceptors respond to noxious stimuli that can produce tissue damage. There are two major classes of nociceptors: thermal or mechanical nociceptors and polymodal nociceptors. Thermal or mechanical nociceptors are supplied by finely myelinated A-delta afferent nerve fibers and are fast and respond to mechanical stimuli such as sharp, pricking pain. Polymodal nociceptors are supplied by unmyelinated, slow C fibers and respond to high-intensity mechanical or chemical stimuli as well as hot and cold stimuli. Damaged skin releases a variety of chemicals including bradykinin, prostaglandins, substance P, potassium ions, and hydrogen ions, which initiate the inflammatory response. The blood vessels become permeable, and as a result there is local edema and redness of the skin. Mast cells near the site of injury release histamine, which directly activates nociceptors. In addition, axons of the nociceptors release substances that sensitize the nociceptors to stimuli that were not previously noxious or painful. This sensitizing process, called hyperalgesia, is the basis for various phenomena, including reduced threshold for pain. Back to the somatosensory pathways. There are two pathways for transmission of somatosensory information to the CNS: the dorsal column system and the anterolateral or so-called spinothalamic system, as seen in Figure 3-10. Each pathway follows the general pattern already described for sensory systems. The receptor, with its first-order neuron conveying axons to the relay nucleus in the brainstem, which sends a synapse to a nuclei-based cell body from the brainstem, which sends axons as the second-order neuron to another nucleus within the thalamus. Here, it synapses to a third-order neuron whose cell body was within that nucleus and sends axons to the somatosensory cortex, where it synapses to a fourth-order neuron. Each pathway, the dorsal column system on the left and anterolateral system on the right, are unique. They have their own pathways, and the critical thing to keep in mind when looking at this image is that the dorsal column system crosses or decussates at the level of the brainstem, whereas the anterolateral system decussates at the level of the spinal cord. The first-order neuron in the somatosensory pathway is the primary afferent neuron. Primary afferent neurons have their cell bodies in the dorsal root or cranial ganglia, and their axons synapse on somatosensory receptive cells, that is, mechanoreceptors. The signal is transduced by the receptor and transmitted to the central nervous system by the primary afferent neuron. The second-order neuron is located within the spinal cord, or in the brain stem, depending on whether it is in the anterolateral system for the cord or in the dorsal column system in the brain stem. The second-order neurons receive information from first-order neurons and transmit that information up to the thalamus. Axons of these second-order neurons cross the midline either in the spinal cord or in the brain stem and ascend to the thalamus. This decussation means that somatosensory information from one side of the body is received in the contralateral thalamus. The third-order neuron is located in one of the somatosensory nuclei of the thalamus. The thalamus has a somatotopic arrangement of this somatosensory information. The fourth-order neuron is located in the somatosensory cortex called S1 and S2. Higher-order neurons within the somatosensory cortex, as well as other associative cortical areas, integrate all of this complex sensory information that's coming into the CNS. The S1 somatosensory cortex has a somatotopic representation, that is, a map similar to that in the thalamus. This body map of the body is called the somatosensory homunculus, as seen in figure 3-11. The largest areas of representation of the body are the face, hands, and fingers, which are densely innervated by somatosensory nerves and where sensitivity is greatest. The sensory homunculus illustrates the place coding of somatosensory information. Let's switch now to the dorsal column system. The dorsal column system is used for transmitting somatosensory information about discriminative touch, pressure, vibration, two-point discrimination, and proprioception. The dorsal column system consists mainly of group 1 and group 2 nerve fiber types. The first-order neurons have their cell bodies in the dorsal root ganglion cells or in cranial nerve ganglion cells, and ascend ipsilaterally to the nucleus gracilis for the lower body, think graceful legs to remember, or nucleus cuneatus of the upper body, in the medulla of the brainstem. In the medulla, first-order neurons synapse on second-order neurons, which then cross or decussate the midline. The second-order neurons ascend to the contralateral thalamus, where they synapse on third-order neurons, which ascend to the somatosensory cortex and synapse on fourth-order neurons. The anterolateral or spinothalamic system transmits somatosensory information about pain, temperature, and light touch. The anterolateral system consists mainly of group 3 and group 4 fibers. Recall that group 4 fibers have the slowest conduction velocities of all of the sensory nerves because they are unmyelinated. In the anterolateral system, first-order neurons have their cell bodies in the dorsal horn and synapse on thermoreceptors and nociceptors in the skin. The first-order neurons synapse on second-order neurons in the spinal cord. In the spinal cord, the second-order neurons cross the midline or decussate and ascend to the contralateral thalamus. In the thalamus, second-order neurons synapse on third-order neurons, which ascend to the somatosensory cortex and synapse on fourth-order neurons. Fast pain, such as pinprick, is carried on A delta, group 2, and group 3 fibers, has a rapid onset and offset, and is precisely located. Slow pain, or burn, is carried on C fibers and is characterized as an aching, burning, or throbbing pain that is poorly localized. Referred pain is of visceral origin. That is, the pain is referred according to the dermatomal rule, which states that sites on the skin are innervated by nerves arising from the same spinal cord segments as those innervating the visceral organs. According to the dermatomal
Referred
rule,
pain
ischemic heart pain is referred to the chest and shoulder.
The pain is referred according to the
Gallbladder
dermatomal
pain is referred to the
rule,
abdomen, which states that
pain
pain
is referred to the
that
lower
sites
back,
on the skin
and
are
so forth.
innervated by nerves arising from the same
according
spinal
to the
cord
dermatomal
segment
rule,
section
ischemic
as those
heart pain is
innervating
referred
the
to the
visceral
chest
organ.
and